It doesn't mean that the downslope of the peak is going to be fast. It could be that this plateau carries on for a while, and we've seen in other countries where they've started to have lower case counts over time that it can take days and weeks for the numbers to even get cut in half. So I think while we may be at a peak, we hope we are, it's still going to take time for us to start to bring the case numbers down, especially in places which are the biggest hotspots.
Well, medical experts warn that while the coronavirus curve may be starting to flatten out in some spots like New York State, for example, the, quote, downward slope could be a lot slower before we get the all clear. Dr. Sudip Bose joins us. He's an emergency physician and medical director at the Odessa Fire Rescue, also chief medical officer at liveclinic.com and an Iraq War veteran. Dr. Bose, thank you for joining us and for your service. You know,
Hi, Eric. Happy Easter.
The numbers of coronavirus, same to you, happy Easter to you. The number of coronavirus victims and people who've caught it started doubling over days in some spots. But the glide path, once they get to the peak, everyone's talking about get to the peak like you're waiting to get to that peak. What will the glide path down be? Will that be much more gradual?
Well, it's interesting. It's hard to predict is the short answer. I mean, basically, if you look at the SIRS model, you can Google that, SIRS. So what they do is they basically divide people into compartments. So S is the people who are susceptible, I is the people who are infected, and R is the people who's recovered. And then with that, they do calculations, beta, gamma, things like that. And they calculate these peaks and these numbers and plateaus. And here in the emergency room, the challenge is when I see a patient and they're infected, I don't always have a test. And if I do, it doesn't come back within a couple of weeks sometimes. So we don't know who's in the S category, susceptible, who's infected with COVID or infected with something else, and who is fully recovered. So when you plug these numbers, look at plateaus, it's like if it's garbage in for the data, it's garbage out. So what we need to do is correlate it with the front lines. What I'd like to see here in the emergency room is less patients coming in, less patients going to the ICU on ventilators, and then we'll know that in the front lines, it's downtrending, and we follow that, not just the test results and the graphs.
How long do you think it'll be until we get to that? Obviously, it depends upon the geographic area in which someone lives.
It does. It depends on the geographic area. It depends on seasonality. It seems like there will be no seasonal change. Like influenza, for example, a little bit of heat kills the virus, but this viral particle has a protective lipid core around it, and it seems like it's resistant to heat. And if you look at Abu Dhabi and some of the other warmer places, it looks like it's going to last through the summer. And what I suspect is that we're going to just have multiple peaks and troughs, and this is going to be flattening a roller coaster. So we have to do this in a very calculated, careful way to minimize the casualties from this.
Wow, a roller coaster. I mean, it wreaks havoc with the emotions as it is and with the economy and with people's health, with so many deaths. In New York State, for example, they saw a reduction in the number of emergency room acceptances at some point, but the number of deaths then went up, so it doesn't always correlate. Here's New York Governor Andrew Cuomo talking about trying to flatten it and seeing what happens after the peak. Here he is.
It has been flattening, but flattening at a terribly high level. Put in the context of 9/11, which was supposed to be the tragedy of my lifetime, 2,753 lives lost. We're now at 9,385.
Flattening at a high level. I mean, so when do we know? Sadly, it's high when it starts to suddenly go down and then not go up. But, you know, you're predicting that it will, or it could. Dr. Bose, can you hear me?
Yes. Can you repeat the question?
We may have lost Dr. Bose. Oh, good. Yeah, go. Yes. The question is, Governor Andrew Cuomo just said that they see a flattening here in New York. Thank goodness, but it's at a very high level. So certainly, you think that it'll go down, but also potentially go up. And when can we get to that point when it's quashed?
Well, that's a great question. And again, we can't make a federal decision based on just New York City. But in my opinion, it's when we see decreased cases into the emergency room. Because again, remember, when we're looking at these test results, sometimes they're not immediate resulted, sometimes they're false negatives, and we can't be following graphs. We need to follow what's actually happening live time on the front lines in each location. And what I hope is, depending on these calculations, at some point you reach a level of herd immunity, meaning, 70, let's say it's 70% of the people are actually infected already and they're recovered. So they're the herd and they're immune. So you assume they're not going to pass it to others. And that way we kind of get a grasp on this. But we don't have an easy answer, because even like with SARS, we could trace it back. SARS is also a coronavirus. We could trace it back to civet cats in China, and we just annihilated those cats. And now we haven't seen SARS in a long time. That's not going to happen with this, I suspect.
Yeah, and
we have to be very calculated.
And this especially because you may not show symptoms. Let me just finally show you.
Right.
This is the projection now for those states that'll hit the peaks and when they will. And I want folks, if you live in these states, please pay attention. North Carolina, April 17th. Mississippi, April 19th. Alabama and Tennessee, you've got, 8 days to go until the peak. Kentucky, even more, April 25th. And we show the next list if we can. Florida, toward the end of the month. Florida and Georgia. Texas, April 28th. South Carolina, the 29th. Arkansas, the end of the month. A doctor, finally, those are just the peaks. So we're talking about this going through, it seems, through May, June, July, and maybe somehow longer.
Right. And I think, we'll see numbers coming down. And then as we slowly open parts of the economy in different areas of the country, we may see spikes again. And that's why I'm referring to it as a roller coaster. But if we do this in a calculated manner, and our listeners, you're the most important. If you follow the rules, social distancing, washing your hands, et cetera, we can get a grasp on this. You can make it easier for us here in the emergency room.
Absolutely. I want to take a moment, and I'm sure I speak for all of our viewers. Thank you. Thank you for what you do on the front lines. Thank you to the health workers, the nurses, the technicians, the doctors. We are staying home for you. And later on this hour, we'll have another installment on our effort to get those needed masks and medical supplies to you guys who need it. Dr. Sidhu Bose, thank you so much for joining us today down in Texas.